So I met a lady, I was introduced to a woman called Elizabeth Peyton-Jones, who is a kinesiologist and a complete good witch. I think she's witchy, I think she's fantastic, and I think she's wonderful. And she we were talking about an alternative route. I knew that I didn't want to just take the medical route. Nothing to do with the treatment I'd had or the people I'd met. I just wanted to take an alternative route. So she introduced me to, we looked at all the different aspects that I could start working on: healing, massage, diet, etc., etc. And we talked about teeth and amalgam fillings, and I was like, I have them, I have a lot, I know I do. So she put me in touch with el-essawy, who I met, and he was very welcoming and he was very generous in spirit, and I felt very safe with him, and he checked the mercury levels and was like, oh my god. I was like, oh my god, and he was like, oh my god, and he said, oh my god, you have like so many. And he said that his most he's ever seen is 17, and I was 19. So we had to take them out bit by bit. We took them out in 2 separate sessions. I was sedated for about 3 hours. It was very gentle. I fell asleep. It was very nice. I woke up, felt a bit dozy for a bit, but was fine. It was a little bit sore in my mouth, but nothing at all to write home about. It went after a few days. And it took a while, I think, for me to really notice the big changes, but the immediate changes were things like I'd wake up in the morning. I used to wake up in the morning and be so drowsy, I'd have to jump in the shower, la 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 la. My poor little son was like, mama, mama, and I was like, I can't see, I need to have a shower. Literally, I was dopey. And literally, immediately after the operation, I was bright, I was alive, I didn't need a shower, I didn't need anything. I was not dopey. I was very alert, and it was literally as if I hadn't slept. And that is the first big difference I noticed. The second one, which was something which is a really big part of my life, is I used to get terribly anxious and panicky. If I was late, if I felt I wasn't going to be able to get everything done, for any reason whatsoever, I would sort of constantly feel a little bit of kind of shallow breathing, kind of panic deep down, and it's gone. I don't feel it. I have it a little bit sometimes, but I don't have anything like I used to. I literally feel like somebody's gone inside me and just taken something that was quite a big part of my life away and has gone off with it somewhere and disappeared. And you know, who knows? I mean, everything is a big question mark in life, I've decided. But I have to say that I can't think of any other thing that it could be, because I haven't had anything. I haven't had an operation or anything. It's just been the amalgam removal since I've noticed this removal of my panicky feelings and anxiety. I also wanted to say that when I looked at el-essawy's website, I was checking him out to make sure I didn't think he was a dodgeball or anything like that. I noticed he had a list of all the side effects that you can get, and I thought, I don't know about this because I don't have any. I didn't have any. The anxiety and the panicky I had, but I didn't have the, you know, the sort of depression and the tiredness and there was a long list, I can't remember what it said now. I didn't have any of them, and I couldn't understand why, and I had a long talk with el-essawy, and it was just basically, it's all a big mystery, but it's a lot to do with the resistance. And I think because I am, anyway, it's a big mystery, but it was very interesting that somebody like me who had so many wasn't having any side effects. I think that's quite an interesting thought. But so I'm a very grateful patient. I have a whole world of, I've learned a whole world of knowledge and wisdom in my 13 months. And I'm incredibly grateful for the people I've met and the therapies I've had. And I just think that love and health is all that matters in life.
Indeed. Pandora, you were diagnosed with spindle cell sarcoma.
Yeah.
You had operations, you had
Yeah.
radiotherapy,
Yeah.
and you were about to have chemotherapy.
Yeah.
And then you came for the amalgam removal,
Yeah.
and you followed Elizabeth Peyton Jones.
Before I was about to have the chemo.
Before, yes, you came to have the amalgam removal before the chemo.
Yeah.
And that is out of what? You wanted to free yourself from toxins and so on, to prepare your body?
Well, I was really frightened because I knew that mercury is something that, well, is in thermometers, you shouldn't touch it. I was always taught that it was incredibly dangerous.
So when you realized that there is mercury in your body, you wanted that out?
Oh my God, especially as it was in my teeth.
Yeah.
And my teeth is close to my head, and my head is close to my teeth, and, you know.
But you
I
checked...
couldn't take any risks at that point.
But you checked on el-essawy's website and you didn't find any symptoms that you can relate to.
No.
And you didn't know at that time that this is in common with all patients who have cancer. They don't have any symptoms other than the cancer.
Yeah.
And that's a mystery. We don't know why it happens.
Why, yeah.
And then you wisely decided to prepare your body by getting rid of the toxins first.
Yeah.
And you came and you had your amalgam out and your mercury out.
Yeah.
Which is two different processes, by the way. The amalgam out is not the same process as the mercury out. You can have the amalgam out, but you still have the mercury in your teeth. And then you went to have your chemotherapy. What did the doctor say when you were about to have the chemotherapy?
I was all ready. I'd made my home. I'd moved my home from my home. My room looked like home. I'd made my husband drag all the bags. I'd got myself settled, and I realised...
In hospital?
In hospital, in the Royal Marsden, in Fulham Road.